Hello everyone and welcome back to Medigap Show. I'm Holly Cohen, founder of medigapcares.org. We are a team of licensed agents here to help guide you onto Medicare and beyond and help you every step of the way. Today we're diving deep into a crucial issue that exposes the limitations of Medicare Advantage plans, especially when it comes to prior authorization. So stay tuned as we explore this topic further. Let's start by unraveling the concept of Medigap, also known as Medicare Supplement Insurance. Medigap plans are designed to complement original Medicare, filling in the gaps that Medicare might not cover fully, that 20% after original Medicare pays the first 80%. A Medigap plan allows you to choose any healthcare provider that accepts your red, white, and blue Medicare card, giving you the authority to shape your Medicare decisions and go to the provider that you choose. Now let's shift our focus to Medicare Advantage, or also called Part C plans, offered by private insurance companies. Bundle various services such as dental, vision, and prescription drug coverage. However, it is very important to realize that these plans often come with limitations, including being restricted to a network of healthcare providers. Now let's talk about the prior authorization process, which involves insurance companies evaluating the necessity of a treatment before agreeing to cover it. And a recent article has emphasized this bureaucratic procedure can lead to overwhelming paperwork and unsettling delays in receiving critical medical care. Now, let's delve into the specific hurdles that you may encounter with a Medicare Advantage plan when it comes to prior authorization. While these plans offer a broad spectrum of extra services, they often bring along limitations. These may involve being tied to a specific network of healthcare providers, and in numerous cases, mandating prior authorization for specialized treatments. This can inadvertently pave the way for potential delays of care, as evidenced by a poignant story from this article. The two words that can make healthcare a nightmare: prior authorization buries doctors in paperwork and delays care, sometimes with disastrous results. Published in New York Magazine on July 10th, 2023, written by Chris Stanton. The gentleman mentioned in this article, Mr. Dan Hurley, unfortunately, at the age of 50, has since passed away from cancer. So please listen as I read through some of this article now. It just shines light on not just our Advantage plans with Medicare Advantage, but also our under age 65 healthcare. And as I always explain as I speak to our clients, when you're under 65, we are forced to be in this type of healthcare with prior authorizations. However, when you are ready for Medicare, you're Medicare eligible, it is a shame to give up your original Medicare rights, where everything that is considered medically necessary by your doctor has to be covered by Medicare at 80%, and then a Medigap plan fills in the 20%. And of course, Medigap plans are not available for everyone at all times. And sometimes someone's only choice is a Medicare Advantage plan. I can't change healthcare, but I can report on this information. And I'm going to continue this article right now. After experiencing mysterious hip and back pain for about 6 months, Dan Hurley finally went to see an orthopedist in December 2021. The diagnosis after an MRI and a subsequent biopsy was metastatic, dedifferentiated chondrosarcoma, an aggressive cancer in his pelvic bone. Hurley, then 48, set about finding specialists who could maximize his chances of survival and grant him more time with his wife and 3 kids at their home in Phoenix. Treatment began quickly and aggressively. 2 months later, he had a hemipelvectomy to remove a portion of his pelvis and implant a new hip, leaving him unable to walk for several months. As an ear, nose, and throat physician with over 20 years of experience, Hurley entered into his battle with cancer knowing full well that his treatment would involve constant back and forths with his insurance company, Blue Cross Blue Shield. In particular, he anticipated disputes over prior authorization, a controversial bureaucratic process that insurance companies use to determine which treatments they believe are medically necessary before agreeing to cover them. Again, as a side note, when you're on original Medicare with a Medigap plan, there is never a prior authorization. That term, medically necessary, is all that original Medicare needs to know in order to cover your condition at 80% and all of its treatments. When a person is on under 65 health insurance, whether it be an individual policy or group commercial health insurance, or if they are on Medicare Advantage, that means that they are on a private insurer's healthcare program, which usually requires prior authorization in many instances. Hurley was all too familiar with the administrative burden that prior authorization places on doctors' offices, often requiring them to fill out labyrinth paperwork on behalf of patients for even the most routine procedures and medications. More important, Hurley had seen how the time-consuming process could delay a patient's care, a minor inconvenience to some, but a potential matter of life and death for people like him. This is happening all day, every day, to everybody, Hurley says. If you just need a sinus CT scan because you're seeing an ENT, you don't notice it as much, but your sinus infection isn't about to kill you. It didn't take long for Hurley's concerns about prior authorization delays to be proven correct. By July of last year, his tumor had proven so aggressive that doctors began to plot a new course of treatment. When they ordered a PET scan to assess the cancer in his body, the insurance company denied it, prompting Hurley and his doctors to appeal the decision. Multiple denials later, the insurance company finally approved the scan the day before Hurley was set to begin chemotherapy, forcing him to choose between getting the scan, which would delay his chemo, or skipping it altogether. He chose the latter, which later on left his doctors with one fewer benchmark to assess how effective his treatments had been. Ever since his experience with the delayed PET scan, Hurley has largely paid for his scans out of pocket to avoid delays, knowing he'll be able to get at least some of them refunded by Blue Cross after the fact. He's careful not to recommend this strategy, which involves going out on a financial limb. Recently, he had a recurrence and began another round of radiation and chemo. At every stage of Hurley's fight against cancer, prior authorization has created roadblocks. When he recently had a bout of life-altering pain that required radiation, his doctors quickly worked up a plan and scheduled the treatment for a week later, leaving them what they believed was sufficient time to secure prior authorization. They couldn't have scheduled it at a moment earlier. 6 days later, Blue Cross still hadn't approved the treatment, forcing Hurley's doctors to go through an appeal process. 6 days later, the insurance company still hadn't approved the treatment, facing Hurley's doctors to go through an appeal process and raising the possibility that Hurley, who normally has a positive outlook despite his diagnosis, would have to live a little longer with the kind of pain he says kills your spirit. While he eventually got the radiation, those frequent scenarios have taken an emotional toll over the course of his treatment and make him wonder what the outcome would have been for someone with fewer resources or less knowledge of the insurance industry. It really feels like they're trying to kill you, Hurley says. I know they're not, but that's what it feels like. Very, very, very sad situation. And again, he is no longer with us. At 50 years old, he has lost his battle with cancer through the prior authorization process. And it's just a very sad situation. Thank you for joining us on Medigap Show. We encourage you to hit the like button, share this video with others who may benefit from this information, and subscribe to our channel for more valuable insights. This will tell YouTube to send this information to other Medicare beneficiaries across the country so they can understand the big difference between original Medicare with Medigap versus Medicare Advantage. Remember, your Medicare decisions matter, and we are here to guide you every step of the way. Until next time, take charge of your health and make well-informed Medicare choices. And as always, be well.